Okay. Knock, knock, knock. Can I come in?
Yeah, you can come on in.
Hi, my name's Haley. I'm going to be your student nurse today. How are you doing?
I'm in a little bit of pain.
Where's that pain happening?
On my abdomen area.
All right. Before I go ahead and assess that pain, can I get your name and your date of birth, please?
My name is Nicholas Soros, and my date of birth is August 23rd, XX.
Okay, Mr. Soros. I do see that. Let me just double check your MRN. Okay. Do you have any allergies to anything?
No allergies.
Okay. And just double checking, no allergies to shellfish, betadine, or iodine?
No.
Okay. Is it okay if I move this out of the way so I can assess your pain?
Yeah, that's fine.
Okay. So you said it's in your abdomen. How would you rate that pain on a scale of 0 to 10? 10 being the worst pain.
It's a 7 right now.
7. I'm going to go ahead and move you up. When did that pain start?
This morning.
Okay. Does anything make the pain feel better or any worse?
Honestly, right now, no. I can't tell the difference.
Okay. Let me just get you up here, and I'm going to grab some gloves, and I'm going to put your food on your table next to you, okay? I'll put it back when I'm done here. All right. Let me go put this back. All right. So I'm going to assess your abdomen because you're saying you're having a little bit of pain there. So sorry, I'm going to have to lift up your gown and then just tell me if you have any tenderness or anything when I'm palpating, okay?
Okay.
All right. I'm going to go ahead and pull this down.
Okay.
Pull up your gown, sorry. All right, your abdomen does look a little distended, so I'm going to palpate.
Oh, yeah, that's pressure.
Some pressure, okay. Yeah, so your bladder is pretty distended here, and you are in pain. I see on your chart that you have an order for a Foley insertion, as well as an order for a urine sample. Do you know what a Foley or catheter insertion is?
Yeah, I'm a retired physical assistant.
I saw that you were a PA.
Yeah.
Okay, so just so I can remind you, I'm going to be putting a small tube. It's going to go up your urethra and sit in your bladder. So all of that fluid and everything that's being retained in your bladder and causing you this pain, it's going to help manually bring out all of that fluid, okay?
Right.
Okay. It's going to be a little uncomfortable, but it'll make you feel a lot better after. All right. I did talk to the CRNA and she said she came in and gave you some peri-care and did a bed bath. How was that for you?
Yeah, she came in and
She did
clean.
come in?
Mm-hmm.
Okay, perfect. All right. Going to put gloves on and sandy wipe this off and let it dry for 2 minutes. I'm going to grab my trash. Okay. Just going to set these on here and then I'll get set up after. All right. I know you're in some pain here, but I am going to put you in a position that's a little bit easier for the catheter insertion. It'll make it more comfortable for you, okay? All right, I'm going to uncover you here. All right. Sorry if you're a little cold. I'll put it right back after, okay?
Okay.
All right. Are you able to bring your legs out?
Yes.
All right. Okay. All right. That's okay. All right. Just give me 1 second here and then we'll get started, okay?
Okay.
I'm going to set this right here just as my little trash and I'll remove it after. Okay. Okay. Just make sure these are on here. All right. I'm gonna go ahead and put this in between your legs. Shiny side down here.
Yeah, so your doctor ordered manual irrigation of your catheter. Are you familiar with that process?
Right.
So that's basically we're going to be kind of pushing water through your catheter to try to make it flow out and something out. That way we can restore the flow and help you kind of get rid of some of that urine in your bladder, which should help with the distension and the discomfort. Okay. Before we get started with that, though, I am going to do a quick abdominal assessment. Is that all right with you? Okay. We go ahead and grab some gloves.
All right. Sorry, I'm just getting set up here and we'll get started right away, okay?
Okay, yeah, take your time.
All right, that's ready. All right, so I'm gonna go ahead and start to clean the urethra and around the penis as well here, okay?
Sounds good.
Just so we decrease any risk of infection at all, okay?
We'll go ahead and get started with catheter irrigation. If
There's
that
one.
feels uncomfortable or it's too painful, please just let me know. But we'll try to make it short and restore that flow as soon as possible.
Two.
Alright. I'm gonna go ahead and get started.
And three, okay?
So we got
Okay. All right. Gonna go ahead and set this in between your legs here, just on the towel. Okay. Sure. All right, so on the count of three, I'm going to begin inserting the catheter, so just bear down, okay?
Okay.
All right, 1, 2, 3. Inserting, inserting, inserting. How are you doing, sir?
Doing okay. Good, just
Okay. All right, so I see a flash of urine. I'm gonna go all the way to the bifurcation. All right, pinch here. I'm gonna fill that balloon inside just to ensure that it's staying in your bladder with 5 milliliters of water. All right, going to disconnect that. Okay, I'm just gonna make sure it's in your bladder, so I'm gonna pull back here. All right, feel some resistance, so it is in your bladder. How are you feeling?
Feeling a little bit better.
All right, let me go and just get you covered up here so you're a little more comfortable before I attach this to your leg. All right, sorry. Let's go ahead and put your legs back down. All right, I'll get you all covered up in just a second. All right, I'm gonna attach this to your leg right here to get you covered back up. How is your pain now on a scale of 0 to 10?
It's like a 5.
A 5? Okay, I believe it was a 7 before, so that's sounding a lot better. All right, and I am going to put my name and my time and date on here, as well as your information, so we're just ensuring that this is your bag. I'm gonna place it on a non-movable part of the bed, under the bed, and it's really important that this bladder bag stays below the bed, okay?
Okay, sounds good.
Because it needs to manually drain out all of that urine, and the only way you can do that if it's below your bladder. Okay, and as I mentioned, you do have an order for a urine sample, so I'm gonna go ahead and take that and send it to the lab as well. These get sticky after a while.
Yeah, I remember.
Oh my goodness. Okay. Go ahead and take this. Set the cup upside down here. All right. Going to move trash can up and over here. Go above just in case to make sure if any of it drains. All right. Without touching. Getting your sample there. All right. Putting that back. Okay. And then I'm going to do my name, date, and time, as well as your patient tag with all of your information on that, and I'm going to send that to the lab, okay?
Okay, sounds good. Thank you.
All right. And then I can go ahead and clean up here a little bit, get your food back to you. All right, so you said your pain's a 5 out of 10 now, so it is improving.
Yeah.
All right, I'm going to lower you back down here. So, where should that bladder bag be at all times?
I think you said below my waist.
Below your waist. Always below the bladder, okay? And then anytime that you need to get up or move around or need anything, I want you to press your call light because we don't want this catheter to come out or anything or move around because I'm sure you don't want to have to go through that again.
Yeah.
So let me grab your call light here and just if you need anything else. So you have that. Around the bed here. All right, so there's your call light. Do you want to be placed up in bed or are you okay right
I'm
here?
okay like this. I'm gonna rest for a while.
Okay.
Medication, you still want to do
Thank you though.
You're welcome. Let me go ahead and put this back.
Well, I definitely still said about infection.
Let me get your tray table back for you.
Because it's already happened, there's a risk for it happening again. So we want to
There's your food. And like I said, I'm going to send this off to the lab, okay?
Okay.
Thank you so much. Let me know if you need anything.
Okay, thank you.
You're welcome. Bye-bye.
I think the bags here.